Hi, my name is Sydney Wilson. I am a senior nursing student here at Tennessee Tech, and I am joined today by my sister, Madilyn. She is on the laptop right here, and I'm going to be sharing my screen with her so that she can follow along on this presentation with us. Maddie, can you say hi?
Hi.
All right, so I'm going to share that screen with her. Share the screen. Okay. Oh, can you see it, Maddie? All right. Now, for those of you who are not aware, the United States has the highest number of incarcerated individuals in the entire world. That means that no other country has more of its citizens within a prison than we do. And what are we doing to take care of this significant population within our country? The short answer is nothing. So, there are roughly 2 million incarcerated individuals in the US. And overall, their healthcare is being negatively impacted due to their highly stressful situations, their cramped living quarters, and lack of resources and staffing within correctional facilities. Detainees receive a comprehensive physical assessment during the intake and booking process, but after this, they receive no annual exams or regular checkups with a physician, which means that throughout the duration of their sentence, they receive no primary health care. And according to Healthy People 2030, which is a healthcare initiative that is released every 10 years, and it lines out certain vulnerable populations within our country and goals concerning their health that they would like to be reached within the decade. And according to Healthy People, studies have shown that when compared to the general population, people of both sexes who are incarcerated are more likely to have high blood pressure, asthma, cancer, arthritis, and other infectious diseases such as tuberculosis, hepatitis C, and HIV as well. Now, these individuals are getting sick at a much higher rate than the general population. However, they are receiving little to no preventative care in regards to these disorders. So what resources do we need fixed immediately? Well, the priority would be legislative reform. So a lot of people may be familiar with Medicaid, and this was released in 1965, and it offered financial assistance to low-income families who needed help, who fell below a certain level of income or resources. So many people who are incarcerated come from low financial income households and also qualify for Medicaid. However, there is a specific statute within this policy that is titled the Inmate Exclusion Policy. And unfortunately, it does exactly what it says. And this states that Medicare will not cover healthcare costs for incarcerated people, with the exception of inpatient hospital stays lasting longer than 24 hours. So unless you are having a medical emergency that requires for you to be hospitalized for a long-term visit, then you receive no coverage under Medicare, which means that these inmates who are unable to have a regular source of income are now fully financially responsible for all healthcare costs that they accrue during their sentence. Also, more staffing and available resources are needed for this population as well. Currently, the majority of state and local facilities are only staffed by a team of 1 RN and 3 LPNs for the entire prison. This is simply ineffective, and these nurses are physically unable to meet the demands of this entire population. So why is change a necessity? Well, proportionally, like I said, state and local correctional facilities contain the largest number of inmates, which means that these criminals are receiving time for lesser sentences and will undoubtedly return to the population soon. So when these individuals are released and expected to rejoin society, do we want them to be truly reformed or repressing years of anger and harboring real diseases back out into the population? And these are my available resources. Thank you.